Happy Friday, everybody, and welcome to the internet's favorite show about plastic surgery, health, and beauty. We got a great show for you today. First off, I got one of the craziest medical videos that I've ever taken. I can't wait to show it to you. Next, women and medical misdiagnosis. And lastly, should you get a facelift in your 40s? We're going to talk about it, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the great Sarah Bennett.
Hi.
And in the box, Travis. What's up, man? How you been?
I'm good. How about y'all?
Doing good, man. It's Friday.
Yeah, it is.
It always seems to be Friday when we do the show. It's one of the best things about doing the
It
show.
always seems to be.
It means
right.
Friday.
It's consistency.
It is. Yeah, I like that.
Very consistent.
Yeah, so it's been a good week for y'all. Anything exciting? New? Nothing new?
Not really. Not really.
Pretty copacetic.
Everything been pretty consistent as well.
I don't have anything. It's kind of slow this summer. It's funny, even in the hospitals are a little bit slow. I guess people are staying healthy and people don't want surgery. I guess they're all on vacation or whatnot. So I actually had the morning off, which is really unusual. I'm always operating on Friday mornings. But yeah I slept in. And
one interesting thing I did, I went to an immersive video game spot.
Okay, tell me all about
What
that. 'Cause
game?
I don't know if you guys know this, but I'm a closet super gamer here. So.
Really? Okay.
I knew that already.
Oh, you knew that? Okay, tell me, what was it, Charles?
So you might like it. It's called Sandbox VR.
I think I've heard of it.
Have you heard of it? Okay. Basically, they put these goggles on you, and then they put these sensors on your wrist and your ankles. And then they take you into this room, and they put headphones on you as well. And then you basically are simulating like fighting zombies, or you can play, I think, like what is the game? They just turned it into a movie.
This Is Us?
No. It's like
Oh.
it's the guy with the axe, and it's another one with like a bow and arrow.
Dungeons and Dragons.
Yeah, you can simulate Dungeons and Dragons.
Yeah, I just saw that. So
That was it. So we simulated the zombie fighting one. It was really cool.
That's pretty cool. So I have to admit, I actually have a VR setup at home. Like I'm kind of a computer nerd, and like I like to build computers. And so a couple years ago, I built a VR setup, and it is pretty amazing. Like the technology is really making some big strides. So I have like a second generation kind of VR headset, which is a huge improvement over the first. And it's really good. I have to say there's a couple things that I've done in there where I've been in the VR, and then when I take it off, it's really disorienting because like your brain thinks that you're in this location, and then when you suddenly like materialize in a different place, it kind of messes with your head a little bit. Like
I'm sure that's just another addictive way of video games, I feel like. Just
Yeah.
another way to get you really addicted.
So I kind of feel that in the future, VR is going to play a really big part in our lives because, for example, you could attend school through VR if you wanted to. And so for, people who may not have as good of resources around them, they could do VR and basically get into like a classroom that's virtual and have like a really good learning experience. And you could extrapolate that into college or whatever. And so it's funny, I read a book. Do you guys remember the movie called Ready Player One?
Oh yeah.
So I actually read this. That's actually from a book which came out in 2011. And in the book, which is always really different from the movie, it goes into a lot of how VR got intertwined in society and all the changes it made. It's actually very, very interesting. So, and I firmly believe that book's kind of ahead of its time. Like I think that is what the future is going to be like.
Yeah.
Not like the movie. The movie was obviously for strictly entertainment. But
Yeah. You know the movie that they remade with The Rock, and it was about not a video game, but I forget what it's called, Jumanji.
Oh,
it's about a board game.
It was Robin Williams the first time, and then
Yeah, but like at the end of the movie, I remember The Rock's character was like, because he was this like dweeby boy in high school, but he was this big, massive, heroic guy in this video game, and I'm like, I could see VR having
Oh, totally.
that aspect where kids are like, I'd rather just live here because I'm whoever I want to be here.
And that's like some
That's
of
scary.
the things that the book talks about, that in the virtual world you can, change your appearance and who you are and how you present yourself. And so there's definitely some interest in that. So
Yeah.
that's really cool, Travis. I haven't done that. I have played around a lot with the VR at my home. And I'm waiting for, I think the next generation is when it's really going to kind of take off. Right now, you need like a really powerful computer and this equipment, but just like everything, like computers were, it'll get easier for the average person to start consuming it. And then I mean, remember when iPhones came out and everyone's like, I don't need an iPhone. What do I need this thing for? And then suddenly a few people started using it. And yeah, I think it's going to be big in the future.
Yeah, it's facts.
So.
It's facts. It was really cool,
definitely.
though. It was dope.
Yeah. So I didn't want to make this a segment. I do want to do an update. Do you remember we did this segment last week about the plastic surgeon that was on trial for
murder?
For the death
Not
of a
calling
patient.
911, yeah.
Yeah, so actually that verdict came out this past week. They convicted him. And so for those who didn't see last week's segment, there was a plastic surgeon, Dr. Jeffrey Kim, out in Colorado, and he had an 18-year-old patient in his office that went into cardiac arrest. He resuscitated her, which is great, but then apparently, according to the court, he refused to call 911 for 5 hours, and she ended up dying. And so we were talking about that last week, and the trial ended this week. Apparently, it was really quick. They didn't convict him on negligent homicide. It ended up being some form of manslaughter, but he's like facing 3 years in prison. Like it's for real.
It must have been like overwhelming evidence for them to come up with the verdict so quick too.
Yeah, I mean, yeah, I would
He probably had his whole staff was like, he told us everybody not to call 911.
Yeah, right. I mean, I wasn't there. This is all from what I read, but it sounds like that it was pretty slam dunk that this definitely was some like a crime committed there. So
yeah,
that's crazy. It's really sad, and so once again, as always, we don't talk about these things and sensationalize them. It's all about, is there anything you can learn to prevent that from happening? And,
right.
I think one of the things, too, for medical people, and this is really big in the places I work, you see these signs that say, if you see something that you think is unsafe, say something. And I really do believe in that, honestly, because, I don't think everyone's like this, but there are times when people in power can abuse that.
I mean, when anybody's in any sort of power, it usually always gets abused.
I don't know if I'm that pessimistic, but I hear what you're saying. Yeah.
I feel like sometimes it's like inevitable.
It goes to people's heads. The best people to lead are the people who don't want to lead, right?
Yeah. That they have to.
But they have to.
Yeah.
That's a good call. So, anyway,
I feel like it's that. I mean, I feel like that story is just good information, anyways, for like medical workers that are like they're looking for jobs. Right. Like maybe don't work for somebody that has in office, like not that it's like super
I hate
bad,
to say that
but
because
like
there are tons of great plastic surgeons and other doctors who have office ORs, but it does take away one potential layer of protection, of patient protection, in that OR, that particular doctor has no oversight, versus in a facility they do have oversight.
Yeah.
So I mean, it's just something to keep in the back of your mind. Mm-hmm. I've thought many times about my own OR, and quite frankly, the biggest reason I haven't done it is that it just seems like a huge headache to have like another thing that you have to manage. Mm-hmm. I mean, there's some other reasons I haven't done it too, but I don't know. I like doing a surgery center, and when I talk to my patients, I'm always like, oh yeah, I do my surgeries at an accredited surgery center. Like this place is totally legit. It's regulated and all that, to a very high level, and I don't know.
Safety for everybody.
Safety, yeah, right. We want to be safe. So
yeah.
All right, so guys, I have something for you guys that I want you to see, okay? Now, have you guys ever seen the movie Alien or Aliens?
Yes.
Where the creature bursts out of somebody's stomach?
Yes.
Absolutely.
Roll the clip.
Oh, wow. Oh, gosh.
You should see Sarah's face right now.
Is this on somebody's stomach?
Yeah, it's somebody's stomach.
Is that a stomach? I thought it was a shoulder.
No, it's a stomach.
That is a stomach. That is wild.
And is there something inside them?
I don't know. Check it out. Look, there it goes.
I hate it.
I hate it. All right, guys, what do you think you're looking at there? Any guesses?
Is it like pus?
Like moving pus?
Yeah.
Nope.
Is it a worm?
Nope. So what you're looking at, that's actually the intestines moving. So this patient had a abdominal surgery.
I was going to say that.
Oh, you should have. I saw it in your eyes. I thought you were about to say it.
I was
so this patient had a surgery where they went through the middle of his abdomen to. Are you okay, Travis? You're not gonna pass out in there, are you?
I don't know.
So this patient had a surgery where they opened up his abdomen, and he had complications after the surgery, and he has what's called a fascial dehiscence and loss of domain. So what that means is that the layer that separates his insides, like his intestines and his organs, split.
Okay.
And then his intestines kind of went out into that space. And because of where he was in his like overall medical health at the time, and the fact that it would have been really difficult, they opted not to try to go back and put his intestines back in, which happens because when this occurs in somebody and they get sick, it's extremely dangerous to try to go back and put the intestines back.
Yeah.
And a lot of times you can't do it, and then you can get like holes in your intestines, and then people really can end up dying. So one of the solutions for that is you basically do wound care on top of the intestines. You get a little layer of tissue to grow on the intestines, and then you put a skin graft on top of it.
Okay.
Then that way he has a covered wound. He can go on living his life. Of course, he'd wear a binder over his abdomen, but he can go on living his life until everything on the inside calms down, and then the surgeon can go back and fix it where it's safe. And so that's exactly what happened. So he came to me, and he had this big open wound, and literally his intestines were sitting right there. And so we started wound care. We got a layer of tissue growing on there. Then once the layer of tissue was healthy enough, I put a skin graft on it. But that layer over the intestines is only skin thick. And so when he eats and his intestines move, you can see it right through the skin. Pretty crazy, right? Doesn't it look like the aliens, like something's about to jump out?
It does.
Yeah.
I was like, he's pregnant.
Does your intestine normally move? Like
Yeah, totally.
Does?
Yeah, absolutely. So like when you open someone up for surgery, you can see the intestines move. It's almost like snakes in a basket, like moving around. Now, a lot of times the patients haven't eaten because we require people not to eat before surgery, so they're not like super active.
Right.
But then if somebody has like a trauma or it's an emergency, their bowels might be moving when you open them up. But yeah, they kind of like, it's called peristalsis, where it's basically where the bowels are squeezing to move food, down the line. So
wow.
I don't know. I thought you guys would like that. I saw that and I was like, dude, would you mind if I take a video and use it? And he's like, no, dude, go ahead. He's a super great patient. If he sees it, I want to thank him so much for letting me use that.
Is that painful?
Which part?
Like not having your intestines secured?
No, I think most people would say that they feel like a weird pressure, because it's really changing how the intra-abdominal pressure is to have this big opening that kind of allows things out. So I think people would say that it's an unusual feeling, but I don't.
Not painful.
Him and other patients I've treated don't describe it as painful.
Wow, that's interesting.
Pretty wild stuff.
I've never seen anything like that before.
Yeah, that's a pretty crazy video, isn't it?
Yes, indeed.
All right, so that's really all I got about that one. So let's move on. So this is a really important topic, and I can't wait to hear Sarah's opinion on this one. This is women and medical misdiagnosis.
Okay.
And so I know Sarah, just kind of jumping ahead, that
her eyes look crazy, by the way.
Is this an AI image?
Dude, you guys are so good. Yes, it is.
I was thinking the same thing.
She looks like she needs to be on freaking...
She looks like she's about to turn into the zombie
mutant.
Apocalypse or something. She's like the first one to turn.
She's like I'm from Storm from X-Men or something.
Absolutely.
Oh yeah.
I'm like, dude, she's about to make a storm.
Not to derail my entire segment, but I went through a lot of pictures with AI because I was like, I don't want to I just was easy, I'll get AI to create a picture. But then it created a bunch of pictures I wasn't happy with, and I was trying to get it to do the right angle. And I thought that one's pretty good. But yeah, she does have the storm eyes, and I was totally wondering if you guys were going to see that. So
nice.
Good job, both you guys. Good job.
She doesn't look right.
Yeah, right.
Well,
she just got a wrong diagnosis. So okay, back on track. So medical misdiagnosis occurs when someone gets either an incorrect diagnosis, a delayed diagnosis, or just a failure to make a diagnosis at all. And I remember you and I in the past have talked about that you had an incorrect diagnosis.
Yeah.
And so I want to circle back to that if you're willing to talk about it.
Yeah, that's.
So the first kind of question is, well, Travis, have you ever had that happen to you? Have you ever gone to the doctor and they miss a diagnosis?
I'm sure I have, but no, nothing really major.
Nothing major?
Yeah, nothing major.
I can't say that I have either. I have to admit I'm not great about going to the doctor, but the few times that I've gone were for very specific things, like I broke my neck or whatever, you know, and so it was really not like a big, I was like,
I hope you went to the doctor.
I was in a hockey collision and I can hear my bones cracking when my neck turns. Can you take a look at it? So anyway, they got that one right, but I haven't had it happen to me. I have had it happen to my family though.
Yeah.
And so anyway, so how often does this happen? Well, if you look at the research on it, if you look at all ER visits, it's around 6% that people that get a misdiagnosis, which that's not insignificant.
Yeah.
If it's an office visit, it's less. It's around 1 to 2%. So, I mean, the overwhelming majority doctors are getting it correct, but when you extrapolate that small percentage into the number of visits that occur in the United States every year, you're talking about 10 or 20 million wrong diagnoses that happen every year. And that's to both men and women. And so like, what is the outcome of that? Well, they do estimate that about 100 to 250,000 people die every year because of a wrong diagnosis. It's pretty wild when you think about that. That's a staggering number of people that potentially die because something is either missed or incorrectly diagnosed. And of course, that's just an estimate. It's hard to exactly pinpoint those numbers. They have to extrapolate that from data that's not specific to it. There's estimated to be between 300 and 400,000 people who don't die but receive some sort of harm that requires further medical attention. So when it comes to women, it's kind of understood in medicine that it is a higher risk for women to be misdiagnosed than men. And so I tried to find a good study that gave a
reason for that?
Well, no, we're going to go over that.
Oh, okay.
There's actually some pretty well-known reasons that they're kind of interesting. It's things you don't think about. But as far as so what is your increased risk of a diagnosis being wrong versus me or Travis? And there's no real great study that says exactly what that is, but there's a couple things that try to estimate it, and they say it's like a 20% increased risk. So, for example, if I had to go to 100 doctors to get a wrong diagnosis, you would only have to go to 80. It's a 20% increased risk. So it's not a huge amount, but it's definitely higher for women. And so there is some pretty interesting data about how men versus women feel about their interaction with doctors. So if you ask men and women, have you ever had a doctor ignore or dismiss your symptoms? 20% of women say they have, and only about 14% of men say they have. And if you ask them specifically, do you think that you were treated differently because of your gender? Women will say 17% yes, that's happened, and men only 6%.
Yeah.
So there definitely is a perception of this happening with patients without question, and the data does back that up. So, going back to what you said of what causes this?
Yeah.
What causes women to get more wrong diagnoses than men? So there's really very few people that believe that this is intentional, meaning, I think we're kind of past the days where men are out to purposely harm women. I mean, I think that'd
be strange. Yeah.
Yeah, right. I mean, I think we can all agree that is probably not an intentional thing where doctors are just, maliciously ignoring women out of spite. So, okay, well, if we agree about that, then what caused it? Well, there are a few things they're basically holdovers of gender bias from the past. And so what I mean by that is, for example, in the past, when they would do research studies, they only included men. Well, okay, that's not necessarily a good thing because diseases and symptoms don't always present the same in men and women. And so a lot of the early research that happened in the 1900s was on only men. And so the classic example of that is when they did the study on Ambien, that sleep drug. So the study included only men. And so through the study, they determined a dose. Well, come to find out, men metabolize Ambien much quicker than women.
Yeah.
So when they extrapolated that dose for men to women, it was like way, way too much.
Right.
And so it's kind of one of the classic examples of how these studies in the past only had men ended up giving some kind of negative bias towards women.
Right.
There's also the attribution of doctors sometimes of women's real symptoms to things like hormones. They say, oh, you're anxious, or this is your hormones, or this is, the classic one in the past was the diagnosis of hysteria, right? And so I mean, I don't think that happens too much. I mean,
I hope not. I mean, my doctor that misdiagnosed me was a female, so.
Oh, was she? I was going to ask about that. Yeah. So I guess in that case, you probably don't feel like your misdiagnosis really was gender specific. It was just a misdiagnosis.
No, I mean, I don't think so. Maybe she thought maybe it was age.
Could be, like more of an ageist thing, yeah.
And I went in there very strongly saying, like, I think there's something seriously wrong with me.
Really? We're definitely going to talk about that. So I agree with you that I don't think in this day and age we see a lot of doctors just flat out saying, oh, your symptoms are just, anxiety or hormones. I mean, I'm sure it happens, but I don't think that's like a huge amount. There is this kind of belief and this is more kind of old school than new school, that symptoms present equally in men and women. Mm-hmm. And that's just totally not true for many, many different things.
Well, hormones don't present equally, so.
Of course, I mean,
nothing's really equal.
When I was going through medical school and doing things like pathology, or when I was going through my clinical rotations, I mean, there were very specific times when either a textbook or a clinician would tell me, okay, for this disease in women, it will present differently. Mm-hmm. And so I do remember very distinctly that there were certain things that were presented to me. I'm not sure that's always the case in the past. I feel like things have gotten better as time has gone on, of course. Yeah. But some of that still does persist. And then another thing that's really, and this one I totally believe, is the different styles of how men and women present symptoms. When men go to the doctor, and this is just typically, when men go to the doctor, they're typically very short and succinct. My abdomen hurts when I eat, and so it's like short and to the point, versus, and this is also not to stereotype, but women have more an elaborate, more narrative way to say things. And sometimes I feel, or not just me, I feel, but the research indicates that when that happens in a doctor's office where time is short, then perhaps the doctor doesn't allow them to fully tell what's going on.
Yeah.
So
I feel like guys just don't, like you said, they don't go to the doctor very much until they absolutely have to.
Yeah, so and they're just like, I want out of here.
Maybe their symptoms are just so this is your definite symptoms because they go to the doctor to like at the very.
It could be. I mean, that's
and like women might go to the doctor like I did when I was like. It was preemptive, like it was something, I mean, I should have gone to the doctor about, but it wasn't, I don't know. Girls, I feel like girls are more likely to just
go early on.
Yeah, they're more like preventative. They're like, I better go to the doctor.
So it might be something that's harder to diagnose.
Yeah.
I mean,
that's
actually a great
early
point.
Symptoms.
That's a great point that, I mean, I didn't think about that when I was doing this, and nor have I seen a lot of information about that, but that's actually a pretty great point. Good job, Sarah. I'm going to give you a gold star for today. Also, the last thing is there's some diseases specific to women that are very difficult to diagnose, and so we'll talk about those. So just moving on strictly to that. So what diseases are out there where it has been shown that women are more likely to get a misdiagnosis? And the number one would be heart disease.
Okay.
It's pretty well established, and I remember, hearing about that. I don't treat a ton of heart disease being a surgeon, but I do have knowledge of it. And I do remember learning that things like heart attack do present differently in women versus men. The classic left arm pain, crushing chest tightness, that's more typical with men, whereas women may have more subtle symptoms. And so it's not surprising that there actually was a study that came out that says that women having an MI or heart attack are 50% more likely to be misdiagnosed than men.
Oh.
And so, I don't think in any form or fashion that's, some sort of malicious thing by the doctors, but I think it does boil down to the fact that women do present symptoms differently than men, and people need to be aware of it. Like doctors need to be aware of it. Yeah. Patients need to be aware of it if they can, which is why we do the show. Stroke's another one. There's a 30% increased risk that women would be misdiagnosed with a stroke, which is something that's very important because with strokes, I mean, to a same degree, heart attacks, but especially with strokes, they always talk about there's a window. When you have a stroke, it needs to be treated within a certain time frame, or the complication and long-term morbidity goes up. So that's another one that's really important to kind of realize that happens, that if a woman's having a stroke, like making a diagnosis is critically important. So autoimmune diseases, which are 3 times more prevalent in women than men, take on average 5 years to diagnose. That's pretty crazy that someone would have a problem for that many years and not be able to make a diagnosis. And that does boil down to the fact that those are harder to diagnose. Autoimmune diseases are classically some of the most hard things to diagnose because their symptoms are very vague and they come and go, and there's not always like a very easy test to run. And so it's pretty easy to see how that might happen. And then lastly, some of the very specific female diseases. Endometriosis, that's classic. Women will describe these, cramping, which people, say that, oh, it's your period or whatever, and it's due to endometriosis. And so, that can really get out of hand on people if it's not diagnosed because it tends to get worse and worse. And then things like polycystic ovarian disease are another one.
Yeah.
So, so when you think about that, as far as, okay, well, there's certain diseases that are more common in women that are hard to diagnose, and then women present differently than men. It starts to become a little clear as to how this is happening, and then also the different styles of men and women when they're talking about their symptoms.
Yeah.
So, yeah. Lastly, it's okay. Well, how do you prevent this? Like, how do you make that even? Obviously, we want to eliminate all misdiagnosis in all patients.
Right.
That would be the ultimate goal. But I do think that when you see that one gender has a much higher risk of it happening, that you have to ask yourself, why is that? And what can we do to at least even the playing field before we bring it down for everyone? And so I think, there's things that physicians need to do, and there's things that patients need to do. I mean, for physicians, I always say this, this is a classic saying from general surgery. It says, when you're trying to make a diagnosis, when all else fails, talk to the patient. Listen to your patients. It's something that really bugged me when I was kind of going through my training, when doctors would come in and out and not really listen to their patients, because they truly are the best resource for figuring out what's going on with them.
Right.
A lot of times people rely on studies, and I think that that's a mistake. You do have to listen to what your patients are saying. But moving on to patients, okay, for example, when you went in there and you were saying, no, I think there's seriously something wrong with me, that's right. You did the right thing, truly, because sticking, being confident in that you feel like there's something wrong, and that if you feel that the doctor is not addressing that, when patients are confident and say, no, there's something wrong, I know it, doctors do take note. I've had patients do that to me where, I don't diagnose a lot of stuff, but but sometimes plastic surgery related things do pop up, and I've had patients say, look, I really think there's an issue. And when patients say that, I pause for a minute and I think, okay, am I missing something?
Right.
If I think it's something different, am I missing something? Do I need to dig deeper? And so I think most doctors are like me, where if a patient voices their opinion that something's going on, that they're going to at least pause.
Yeah.
Doing your research is important. I know a lot of doctors would say that they hate when their patients go to the internet.
Yeah, that's what I did.
There are downsides to it because there's a lot of bad information out there, but I will say I love it when a patient comes in for a consult and I know they've done the research and they ask questions that are intelligent. I love it because a lot of times patients don't do that, and it's just me talking to them and they're not necessarily asking questions. And so I love that interaction, but to it shows me that the patient is taking an active role in their care.
Yeah.
And I think it's best when patients do that. I think those patients have better outcomes. And I do firmly believe that if a patient is more involved with their care, then they're less likely to have a misdiagnosis. Sticking to the facts, that is important. It's sad to say, but in this day and age, doctors don't have as much time with their patients as they used to. And so, you want to try to avoid some big, long narrative story about your symptoms. State your facts. This is what's happening. This is when it's happening. And then
started at this time.
That way you at least have a better chance to get your whole story out there before either the doctor has to do something else or, they lose interest, I don't know. But it is important to kind of state.
I've always found that when you tell the doctor everything, you don't leave out stuff.
Yes.
It's almost like a
ding.
The doctor's oh, that's why.
Well, there's a lot of times
you leave out stuff that you don't think would matter.
True, because there's a lot of things with medicine where one little clue will kind of key you in to at least maybe have an idea of what's going on.
Yeah.
So little subtle stuff, that anything surrounding symptoms is important.
Well, recently I mowed my lawn a month ago, and I'd never done that before. And
you've never mowed your lawn? Never in your
my
life.
dad never let
You've
me.
never once in your life mowed a lawn?
No.
How was it?
It was hard.
It was hard. Was this like a push mower or was it a riding mower?
Yeah, it was a push mower, and
push
I have
mower.
I have an acre of property that has
You
to
mowed
be
a
mowed.
whole acre of grass?
Yes.
Did you had to take it? You had to commemorate this?
No, I took breaks, but I mowed my lawn for like 2 hours one day.
Wow.
And I got done and my throat immediately started hurting, and I was like, this feels like strep. And so I woke up the next day and my throat was hurting.
Was it strep or was it allergy?
It was an allergy thing, but I went to the doctor because I was like, this feels like strep. This is strep. And so they swabbed my throat. They're like, it's not strep.
And they were like,
what are you, like, what's going on? Like, why do you feel like you
I
have
mowed
strep?
5 acres of grass yesterday.
And because they were asking me like what happened, like what I was doing, and I was like, oh, I mowed my lawn, and they're like, oh, you had an allergy like attack or symptom, and they're like, so when you mow your lawn again, you need to take like Benadryl, wear a mask, and then take Benadryl
You're like,
after.
screw that, I'm just not mowing the lawn ever again.
No, I bought it like
You did?
I borrowed my neighbor's mower, but now I'm mowing my lawn myself.
Wow.
Yeah.
I enjoy mowing the lawn. I do mine.
I didn't have a problem with it until it like made me sick for some reason.
We have almost an acre of grass, and so it takes time, but I have, what are those, zero-turn riding mowers?
Oh, see, I can't get one of those because my property is so...
hilly.
It's like, there's some parts of it
Right,
that are
can I
like
give you a nickel's
way
worth of free
too...
advice?
What?
Please never put your hand up under a lawnmower.
Oh.
Well, people do that. I see patients in the ER all the time that chop off their fingers from doing that. I mean, it sounds stupid, right? But yeah, don't do that.
I promise.
Lawnmowers are dangerous. They're
Promise.
spinning blades, yeah. So anyway, the last thing I want to say about avoiding medical misdiagnosis, I tell my patients this too. Do not be afraid to get a second opinion, especially if something's not straightforward. Or even change doctors.
Yeah.
You know? I have patients come in sometimes and they'll have a very difficult problem. It's like maybe mostly for like revision type surgeries where they had a surgery and it was, I don't want to say botched, but maybe not gone to plan. And they have something that's really difficult, and I will give them a plan, and they'll say something like, well, I heard that, you know, there's other options. And I'll say, look, this is a plan I would put forth, but please, by all means, if you're not comfortable with it, like get a second opinion, like get a few opinions about what should be done. Because I think it's good, because sometimes one doctor might miss something that another doctor would pick up on. So.
I mean, it's only your life.
Yeah, right. It's only
Why wouldn't you get a second opinion?
I don't know. I think well, sometimes there are issues
crazy.
with it's time or getting insurance or whatnot. So, but anyway, medical misdiagnosis in women, it's a thing. Remember those different diseases that's more prone to happen in, and if you feel like your doctor is not taking you seriously, say something. Be your own advocate.
For serious.
Cool. Right on. Okay. Next, this is a pretty good topic, actually. And I have to give a shout out to Jackie Kostick, who is with my social media company. She actually sent me this story. Thank you, Jackie. I do appreciate it. I know you're watching. This is a good one, and it's whether or not you should have a facelift when you're in your 40s. And so this story actually comes from a news article that came out this past week about Kat Sadler.
Okay.
Do you know her?
She looks familiar.
Yeah, she does. I recognized her when I saw her. I'm not sure I could have come up with her name. She's 48 years old.
Okay.
She's a TV host, or former TV host, e-reporter, podcaster, entrepreneur.
She's from E! News?
Yeah, she was a reporter for E! News.
Okay, yeah, that's where I remember her from.
So this past week, she came out saying that she'd had a facelift, neck lift, and eye lift. So 3 procedures. And the reason that this is a story is because, jumping ahead a little bit, these are typically procedures that are done on people older than 40. Mm-hmm. And we'll kind of dive into that. And so she was very open about it, which I think is super cool, because I don't like when celebrities are, going around having plastic surgery and say, oh, this is all natural, when it's really not. Yeah. So she had a really good quote, and pardon my French, but I'm going to quote her directly. She said, of course, I thought, what are people going to think? Who is going to judge me? But I think one of the best parts about getting older is giving 0 fucks about what people think. And I was like, that's really, really well said. I agree with that 100%. But the big question is, I guess, what do I think about someone getting a facelift in their 40s? So I guess the first question you have to ask is, when do most people get facelifts? And so I actually tried to pull some data on that, and it was kind of over the map as far as when do people normally get facelifts. But it does seem to be that early 60s is kind of the average. There are definitely people getting facelifts in their 50s, not a ton. There's a lot of people in their 60s, some in their 70s. And so, the question is the 40s too young? Well, and I'm a pretty conservative surgeon. I know we've talked about this in the past, that I am absolutely not afraid to tell people no if I think they don't need surgery. Like right off the bat, my first inclination is to say that 48 is too young to have a facelift and neck lift. And the eyelids are a little bit different, and I'm gonna mention about that at the very end. So, Travis, can you pull up that next picture? I think it's just a close-up of her face. Yeah. So
is this before?
Yeah, this is the before, right? So when you look at her, I will say that, and this is probably just purely genetics, that it does seem that she does have a little bit more sag to her face than might be average for someone that's 48.
Yeah, maybe right here.
Yeah, a little bit of jowling there, even the mid face a little bit, and I'm going to show another picture in a minute, not a second, of her eyes. And so, the question that I have for somebody that maybe is young, seeking a procedure that's normally done on patients who are older is, does this patient have a circumstance where they are aging more quickly than normal? And so, that is a reason where I would probably, I might consider doing it myself. And so when I look at her, she's a beautiful woman, but, I do think that the aging of her face is a little bit earlier than it might be.
You could see why she wants to get
I could see why she wants it. And so I would tell you that, if she had come into my office, I would have probably tried to convince her to do a non-surgical treatment. Nowadays, there are amazing treatments for the face and neck to make them look more youthful that are non-surgical. And in the past, that wasn't always the case. The technology has definitely gotten better in the past few decades versus, in the more distant past. So we use lasers. I like the Halo, the Cyton Halo laser. Actually, that's the one I use on myself and my wife. That thing absolutely works very nicely.
Yeah. What age should you start using that at?
Well, my 30s. It depends. If you want to prevent your face from ever starting to sag, there are women that use it in their 30s.
How much does the basic package
for you or for the average person?
For the average person. I'm asking questions because I'm like,
yeah.
If you're in your 30s and you're thinking about it.
The Halo specifically, which is, so the Halo is a very aggressive laser. It's not so aggressive like your whole face is going to fall off, but there is about 5 days of downtime. And it does a really, really good job. And it runs about roughly $1,000 for a treatment. But I do love it. Of all the machines in my office, it's the one I use on myself. I do like it. And so that type of machine, the other one I like is Morpheus, which is microneedling and radiofrequency energy to tighten skin. Those machines were made for people like her. They're a little bit early in the game. It's not like their whole face is sagging off. And the reason that those procedures are nice is because you're going to get a result out of them, but if you try to use them when you're too far along, you'll be disappointed. And so I think that she's kind of a classic example of somebody that very likely could have gotten a very, very nice result from a non-surgical treatment. However,
I wonder if she did get.
That's a great question of whether or not she's done in the past.
And then she didn't like it.
That's a brilliant question. I don't know. That wasn't mentioned in any of the articles I read as she tried non-surgical things. I would love to know. That's
because I feel if I was a celebrity and I heard somebody say, "Oh, it's only $1,000 to do lasers and stuff," I'd be like, "Oh, let's
do it."
Yeah. And it works.
That's a great question. And if in the case that she had done that and she didn't get the results she wanted, then it's a no-brainer. It's a no-brainer. Do the surgery. So yeah, if she'd come into my office, I would have tried to push her down the road. And I do this all the time. I get a lot of facelift, neck lift consults, and I'll say, look, you're a little early. Why don't you try this? See what kind of results you get. You might get a result that'll last you 5 years. If you get a result that lasts you 5 years that you don't have to have major surgery, do it. That's no-brainer. And why is that, right? So I guess the question is, why am I trying to push people away from surgery? Well, for one, I always believe that you can get an equal result with non-surgical means. You should do that. There are risks associated with surgery. It's not that there's no risk with these non-surgical treatments, but they're just less. And then secondly, if in the future you really, really need to have the surgery, it's much harder to do. I've done redo facelifts, and I don't like doing them. Like, the tissues are scarred up, the dissection sucks. I mean, it is a little bit more, I don't want to say stressful, but more tedious procedure. I do think the risks do go up. And so when you do something that young at, say, 48, you know, in 20 years from now, when she's 68, which is, you know, nowadays not old, there's plenty of very, very active 68-year-olds running around. I mean, she might need a surgery that then is going to be harder, you know, and if she could put it off a little bit, she might have avoided it. But you know, honestly, I do firmly believe that, you know, it's her body and her choice. I'm not going to dog her for, you know, there were people saying bad things about her, that, why did you do this at this age? Well, I mean, it's none of really your business. I mean, you know, I think when she saw a surgeon, she should have at the very least been offered some non-surgical treatments. But, you know, looking at her, at where she was with her face, if she had said, look, I understand that there's non-surgical things out there, but I really just want to do the surgery because I don't want to have to keep repeating this, I would have done it for her.
Yeah.
I do worry when people come in and they want something and it's super subtle. I think that she had enough. I mean, you even saw, you're like, yeah, okay, I can see what she's talking about. It wasn't like that you have to get a magnifying glass out to see exactly what it is she's talking about.
I mean, not that there's anything for her to be insecure about, but I could see her being on TV and people
exactly why she's asking.
Yeah, it's like, oh, she's gotten older or something.
So in general,
on E-News or whatever.
I mean, in general, to answer the question, should you get a facelift in your 40s? I think that the base answer should probably be no for most people. That if you're in your 40s, there's a lot of great non-surgical ways to get the same result. Yeah. But there are people out there that might not be the right answer for them. And if they want to pursue surgery and they find someone they trust, then I think that's okay.
Yeah. I mean, people just age differently in general.
Yeah, totally. Absolutely.
If I don't wear makeup, I look like I don't know.
How old are you? Do you mind if I ask?
33.
33. I knew you thought you were early 30s.
I'll be 34 this year.
You look great. All right. Well, that's about all the things we have for this week. So good topics. Let me know what you think. Please leave us a comment and come back and watch us next week on Nip Talk.